Hello everyone, welcome to the YouTube channel fmge Dr. Man. In this video, we'll see about the problem with the vascular surgery. So we'll see the how to read the vascular surgery for FMG examination, because these days the question has been asked from this topic. Previously, it was not very important for FMG, but these days, even though this topic is asked very frequently, so we have to see vascular surgery. And vascular surgery is actually divided into two parts. The first part is the venous disorder, and second part is the arterial disorder. So when we first we will see about the vascular disorder. So when we start to read the vascular surgery in the venous disorder, we have to first know about the DVT, deviant thrombosis. Deviant thrombosis is quite important. And when we start to read the deviant thrombosis, first we have to know about the Virchow triads. We have the triads about the Virchow. So you have to know about the Virchow triads. After knowing the Virchow triads, we have to look at the risk factor of deep vein thrombosis, because risk factor is the this is the point from where so many questions has been asked already. So we have to focus on risk factor briefly. And then as we move ahead, when we come to the proper DVT, we have to know about the clinical feature of deep vein thrombosis, how to diagnose, how do we identify that this is the deep vein thrombosis. After knowing that, you have to know about the investigation of choice. It's very important. This is the one-liner type of questions asked very frequently about the investigation of choices of deep vein thrombosis. So you have to know about that. And then after knowing the investigation of choice of DVT, you have to know how to tackle this such problem. So you have to know about the management. In management, we have to know about the two things, the mechanical treatment, and the pharmacological treatment, as well as prophylaxis of the DVT. And mainly you have to focus upon the warfarin. Okay, so what is the way to use the warfarin in case of DVT? Because there is a special situation where we do not give the warfarin alone for 4 or 5 days. We have to mix with some drugs like heparin. So read about the how to use the warfarin in case of deep vein thrombosis. And this was all about the DVT, but this was the in case of the lower limbs. Okay, and there are some one-liners is also asked, that you have to know about the from which vein generally the thrombus starts to form, in which vein most commonly, which causes the pulmonary embolism and which causes the DVT. This is the one-liner kind of questions we have to know. And then of course, yeah, and you have to know about the DVT of upper limbs as well. There is only one disease which is asked but very rarely asked, that is the Paget-Sorter disease. Paget-Sorter disease is mainly seen in case of such people like Julian's throwers, so or who go to the gym and who lift weight too much. So in such people actually it is seen Paget-Sorter disease. So you have to know about the Paget-Sorter disease in case of upper limb DVT. So this was all about the deep vein thrombosis. And the second part of venous disorder is your varicose vein. This is very, very, very important. This is 5-star type of topic, varicose vein, every time asked. Okay, so when we start to read the varicose vein, first we have to know about the anatomy of the superficial vein and deep vein. They ask about the greater saphenous vein most of the time. The position of the greater saphenous vein, and which nerve is related to that saphenous vein. What is the actual point where we can find this greater saphenous vein? So you have to know about the little bit anatomy of greater saphenous vein. Greater saphenous vein and lower saphenous vein. After knowing the anatomy of the greater saphenous vein and short saphenous vein, when you come to the proper varicose vein, we have to know about the pathophysiology. Why the varicose vein develops in people. Okay, so know about the pathophysiology, because this is actually asked. We tend to ignore such things, but they sometimes give in the true or false kind of question. Okay, so after knowing the pathophysiology, we have some test in varicose vein. That is very important. We have not ignored such topics. Okay, so we have to know about the Trendelenburg test. We have the Fagans test we have for varicose vein diagnosis. And we have the Schwartz sign. We have some kind of 2 or 3 signs in the varicose vein to identify So we have to know about the all the method to diagnose clinically, not by the instruments, but clinically, how do we diagnose. So you have to know about the some procedure what we do to identify, like Trendelenburg procedure we have. Then we have the Fagan's method to diagnose the varicose vein. So read about that. And then when we come to the treatment part of varicose vein, they generally ask about the laser treatment, intravascular laser surgery, or radiofrequency ablation treatment. So just look upon this. It's not so important, but they just asked about what is the new modality of treatment in case of varicose vein, that is the intravascular laser therapy. So you have to know about that. Then there is a classification and known as the CEAP classification. I mean the clinical, etiological, anatomical, and pathophysiological classification. This is asked. This is the one topic which we have to know 100%. CEAP classification, because one question, if they will ask you, they will ask you to calculate the CEAP. I mean in which grade of CEAP they belongs to. They will give the clinical scenario and they will ask you to identify in which grade they belongs to of the CEAP classification. So this was about the varicose vein. uh, you know this is the very important. And after knowing the varicose vein, there is one ulcer that is known as the Marzolin ulcer, and it is a venous ulcer which causes the sometimes, I mean, the squamous cell carcinoma. So you have to know about that Marzolin ulcer. They ask the image based question, and sometimes the clinical scenario as well. So read about the treatment of Marzolin ulcer as well. So this was about the venous disorder. I mean the how to tackle the venous disorder in a smart way, because this is the huge chapter. You cannot read each and everything. So this is what exactly it has been asked already in the PYQ of EMS, NEET PG and FMG. So you have to just go along with this, and I think this is enough to solve the question regarding to the venous disorder. In the next video we will see about the arterial disorder. Thank you.